Okay, my viewers from RitmoMagazine.com, we got Dr. Ziegler here, famous chiropractor over here in the city of Allentown. He's going to show us a demonstration of why it's important to follow up with your physical therapy after you get a rotator cuff surgery. Go ahead, doctor.
Okay. He had surgery on the left shoulder, rotator cuff muscle, a small tiny muscle right here that basically helps with flexion, abduction, extension, lateral, and medial rotation of the shoulder joint. We're going to demonstrate on his right shoulder. I want you to go quickly down straight up like this. You see that's a full 180 degrees. Okay, put it down. Now go off to your side. All the way up. Full 180 degrees. Go backwards. Full 30 to 45 degrees. Now bring your elbow up like this. Bring it across. Full 90 and the full 45 degrees. Normal range of motion. On the affected shoulder, we're going to go straight up. That's about 170, 180, not bad. But the most important, go straight back. That's about 150 degrees, which is definitely minimal, below average for the rotator cuff. Now, if the rotator cuff was torn prior to surgery, it would be able to go about 10 to 20 degrees total. If it was partially torn, it would only go to about here, maybe here at the max. So the important thing is we see that the surgery has basically healed, but he's not at full range of motion. Okay, now go backwards. Good. Now bring it across your sternum, and back like that. Okay, we have basically, that hurts right there. Alright, so a little bit of decreased range of motion in that as well. So the important part for physical therapy is simply for the massage therapist to break up any adhesions. Okay, once you have a seat. Now, when I do the manual digital palpation, we can see how this is nice fluid motion. I'm feeling the muscles back here, muscles of the neck, rhomboids, scapula. They're all in concert so that there is no complications, a fluid motion. However, when I go back here, right there, we get like a clicking form, which means the muscles are not in coordination with the joint movement. So even though the surgery was 5 years ago, technically it's okay, but he is not at full range of motion. Now, as chiropractor, we also do the range of motion here, manual palpation. The nerves out of the cervical spine come into what's called the brachial plexus, which go right through here to the shoulder and all the way down to the wrist. So I just treated a patient with carpal tunnel. She had a neck problem from a motor vehicle accident. And what we're finding here is, I would be more than happy, it would be my opinion that he does have some sort of cervical neck problem as well. Alright, now I want you to sit up straight. Look down to the ground. Okay, good. Look up at the ceiling. Okay, those are normal range of motions. Back here, tilt your head to one side. On the other side. Okay, this side, as you can see, is much better. That one's just a little bit off. Look behind you. The other side.
Perfect.
Okay, not bad. However, it should be, it's not, he's just a little bit below average. But once again, manual palpation, there's a lot of tension, a lot of trigger points right in here. And that contributes to the shoulder as well. So the surgeon addressed the specific muscle right here. As a chiropractor, I try to make sure that all the muscles and nerves are coming out of his neck in a normal fashion. And if they're disjointed, or as chiropractors say, if they're subluxated, that's because his range of motion and his spinal alignment is not correct. So we're just going to do a quick, right here I feel a little tension. Okay. Now, real quick, does this feel better? Okay. These are just various tests to show that he might have a little bit of nerve impingement or trapment. Okay, it hurts like that. A little bit of compression. And the last one is this one. I could feel the tension on his neck, so I'm going to give him a quick cervical adjustment. It's basically painless. It looks a lot worse than what it is. Just relax. Okay. And that is the noise of the joint popping. It's not being broken or scraped. And as a patient, that feels better. Now, how do you feel?
Feels good, actually.
He's surprised.
Well,
I am very surprised.
I appreciate Doctor, giving us this demonstration. Will you please let people know exactly where you are located right here and the telephone number, please?
Yes, I'm at 101 South 14th Street, 14th and Walnut, across from the school. My phone number is 610-432-4401. I have a lot of information at ZieglerChiropractic.com.
Definitely, and I understand because, well, my own opinion, in my own experience, you do take like workers' compensation cases from another state, right?
Yeah, I do Pennsylvania and New York. We have a lot of displaced New Yorkers, as you know,
Yes.
and
I-
we see a lot of people don't want to take those cases, but I gladly work with the patients. I see
Okay.
all New York workers' comp cases, Pennsylvania, and motor vehicle accidents as well.
Well, I appreciate your time, doctor, and thank you, Jason. This is the famous little J, Jason Hernandez. He served as our model for today. He's also going to be a patient of yours. So I appreciate your time, and this has been like 5 minutes with Dr. Ziegler right here on RitmoMagazine.com.